For example, you are coding one surgery live chat. While coding that chat, you have encountered multiple CPT codes based on the operative report or surgery report. Then finding CPT codes is very easy. But how do you decide which code you need to use and which code you need to delete from the selected CPT codes? Sometimes what happens when you code the live chat, you will get approximately 5 to 7 codes. Will you use all these codes for finalization of coding, or you need to use only few codes for finalizing for the coding chart? So in this session, we will learn how to decide how many final CPT codes we need to use whenever we will encounter multiple CPT codes. In other terms, we will call it as bundling and unbundling. Today, we will learn few concepts related to bundling and unbundling, as well as few example scenarios related to bundling and unbundling. So why bundling and unbundling is important? So which will provide error-free coding, which will avoid the denials, which will ensure accurate billing, as well as if you follow bundling and unbundling, which will stay compliant. So the basic rule of thumb for bundling versus unbundling is, if the services are part of the same procedure or part of the standard care, those are bundle. If the services are distinct, separate and necessary, those are unbundle. Separate incision. If the patient performs separate incision in order to perform multiple procedures, you need to code it as separately, as unbundle is equal to unique and separate. And complex decision making outside the scope of the procedure and services not integral to the primary procedure. So, for example, if the documentation is having local anesthesia, so mention in the comment section whether local anesthesia is performed by the physician, whether you will code it as bundled or unbundling, or in other ways, will you code local anesthesia separately or not? Mention in the comment section. So if the document contains multiple procedures and stands on its own, you need to call it as unbundling. Next, we will see few example scenarios here. Arthroscopy of the knee. Okay, 29881. Diagnostic arthroscopies and limited debridement always bundled in the arthroscopy therapeutic procedure. Okay, so here along with 29881, you can't code diagnostic arthroscopy as well as limited debridement. So these are already bundled in the 29881. Next one, unbundling example. Knee arthroscopy 29881, treatment of meniscal tear 29882. Here we have medical necessity for these two procedures. So these are unbundled. You can code both 29881 as well as 29882. Next one is colonoscopy with polypectomy 45385, includes biopsy of the polyp. Okay. If the patient performs polypectomy and biopsy of the same polyp, you can't code biopsy of the polyp. Okay. For example, if the patient performs one polypectomy in descending colon and biopsy in the ascending colon, so that time you can code them separately using 45385 as well as 4538059 modifier. Why here you are appending 59 modifier? Why means patient is performing polypectomy in the descending colon, biopsy in the ascending colon. So here we will learn quick memory chart. Okay, so bundling means part of the package included in the main procedure. Unbundling means unique and separate. We need to code or we need to report separately. So whenever you want to code any operative chart, key questions to ask. So yourself you need to ask, is this service integral to the main procedure or not? Was it necessary to complete the main procedure? Is it part of the same operative session? Is it routine or expected, or is it separate and distinct? If yes to first four, you need to consider it as bundle. If is it separate and distinct, you need to unbundling and you need to code separately for related procedure based on medical necessity. So always whenever you want to code multiple CPT codes, you need to check for medical necessity also. So if you does not make sure about the, or if you don't create medical necessity between provided diagnosis as well as the CPT procedure code, there might be a chance of denial. So you need to ensure the medical necessity among the diagnosis as well as procedure. So whenever you want to code any operative chart, you need to follow few tips. Okay. So always you need to follow NCC edits. So if you don't know about NCC edits, please mention in the comment section of this video. I will create one video related to NCC edits. Read the operating report completely or thoroughly. So we need to read the operating report from starting to ending. And also we need to understand global period rules. Okay. So if you don't know global period, please mention in the comment section. I will create one video related to global period. If anyone looking for medical coding jobs in UAE, USA and India, join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery training or SCC training, please send message to 707-526-3939. Whenever you are in confusion, just follow the guidelines. And try to remember IBU. So I means integral equal to bundle. B means basic or routine. All are included in the primary procedure. U means unique or unrelated is equal to unbundling. Bundle smartly, unbundling correctly and code confidently using these tips.